Hey, Dr. Fatima, welcome to the show.
Hi, Brittany. How are you doing?
I am doing awesome. I am
Thank you
so
for having
excited
me.
to have you on the show. We met on Clubhouse.
I know we did, of all places. I mean, Clubhouse is proving to be a great way to meet people you didn't even know existed that you should have met ages ago. So
110%. There's people that I'm like, I feel almost ashamed that we haven't been connected yet. There's some people that I'm like, it's so obvious. And so, listeners, if you have an Android, I'm so sorry, but currently Clubhouse is this like audio chat room thing on iOS, on iPhones, and Fatima and I met each other, and you're in the UK, right?
yes, I'm based in a smallish town called Sutton Coldfield near Birmingham, in the West Midlands in the UK. Yeah, so we've got very different time zones. I think we're quite a few hours apart. I'm
Yeah.
just getting my head wrapped around the different American time zones, and then when the Australians joined, then it was like the Australian time zones, and now like the MENA region. It's a bit mental. I had to literally double check today's appointment several times today just to make sure it was indeed 4 p.m. my time.
I know, it's crazy. We try to do some international things and trying to get Australia, Japan, Germany, East Coast, West Coast, everybody on at the same time. It's impossible. Somebody has to be up at 3 a.m., essentially. It's impossible. Well, I
That's
am
very true.
so excited to chat with you today because of some really interesting things that you said on Clubhouse. And I said, oh my God, Sue Warren, invite her to the show. She has to be on it. But before we get into that, first, I would love to know more about your background. Our listeners love to learn, where did this guest come from? So where are you from? What did you study? Did you have a career before Femtech? And then like, how did you end up here?
Yeah, sure. So I'm a medical doctor by background. I specialize in a field called obstetrics and gynecology. So for the American audience, that's ObGyn. And that's a huge field related to everything women's health. It ranges from reproductive health concerns to gynecological cancers. So cancers of the treating cancers of the womb, the vulva, the ovaries, to doing pelvic floor surgery on the female pelvic floor to treat things like incontinence and prolapse, to things like fetal medicine and maternal mental health as well. I'm based in the UK and I've been practicing as a doctor for the past 10 years. So I graduated medical school 10 years ago. And the reason I chose women's health and to go down kind of this particular specialty was because I was just really passionate about women's health, as cheesy and cliche as that sounds. But I felt that I could really understand the perspectives of the women I was seeing just by virtue of not just being their surgeon or their physician, but as a woman myself. And I could really put myself in their shoes. So that's why I picked that specialty. I also have an interest in technology and entrepreneurship, and I have done for a number of years. And actually, a couple of years ago, I seriously considered starting my own femtech company because I was interested in how I could leverage different technologies to meet the unmet needs of women today. And through that journey, I ended up meeting the founder of a health tech company called ORCHA, and I ended up working for them as their clinical lead for maternity and women's health. And that company is really, I mean, it's been amazing because the impact that I can have on women has gone from the local impact of just being the clinician face to face, meeting one person at a time, to being able to do that on a larger scale and global scale as well.
Amazing. Do you still practice medicine?
I do. So I work part-time or 3 days a week for the NHS, and the other 2 days I have set aside for other projects, and one of them is my work with ORCHA.
So cool. And what that reminds me a lot about, like when I was a scientist in the laboratory, I knew I was studying something that could one day like affect patients and drug therapy in real life, but probably not for at least 10 to 20 years. And I wanted to build something that I knew like I could launch an MVP in the next 4 weeks and like really see large scale impact. And so I could totally relate to that. Let's talk about ORCHA. What is ORCHA?
So ORCHA actually is an acronym. It stands for the Organisation for the Review of Care and Health Apps. And we're a global company that, in my opinion, I mean, I am biased, but we have been truly game changing when it comes to reviewing and regulating healthcare apps on the market. We assess apps based on like a huge set of very strict criteria, from GDPR and data protection issues to UX UI, to their clinical evidence base and the safety of use, if they're classified as a software as a medical device or not, and if they've got all the correct regulatory standards in place. And before ORCHA was founded, the health app market was completely unregulated. Literally anyone who could develop an app could put anything on the app store and not be held accountable for it at all. And people were getting away with this for many years. And the founder of ORCHA, Liz, had noticed this was happening, and she comes from a healthcare background, and she decided she needed to do something about this because it was completely unsafe and really dangerous. These unregulated apps were being used and downloaded by literally, I mean, the numbers were shocking. Millions of people were downloading these. So she set about and developed ORCHA. We don't just review apps and regulate them, but we also offer like prescription services. So a healthcare provider or a doctor could have a look at our library, or formulary as we like to call it in-house, of all the apps that have met our standards, and then recommend them to patients, much like you would with medication. So we don't prescribe meds unless they've gone through some clinical trials and lots of different processes before they eventually reach the doctor's office, who then prescribes it to the patients, and same with recommending surgeries. And on the flip side, we also work alongside developers and help them to improve their digital health solution so that we can bring them up to the standards required. And we really do aim for high standards.
I have a lot of questions. This is fascinating. This is exactly why I was like, well, you just have to be on the podcast, because you talked about this in Clubhouse, and I was like, this is so important. All right, so some questions I have. Is it required to have ORCHA like approve and regulate your app, or is it something that a digital health app would actively choose to have done?
So it's something that the digital health app would actively choose to have done, yes. But we're now more and more working alongside government, and we're working along, I don't remember which governments now globally, but there's multiple governments that ORCHA works alongside to help them with their regulatory processes as well. And so there's some business there that's happening with governments. So they don't necessarily have to have the ORCHA sign off, but for us to go to healthcare providers and say, these are the safe ones, we want them to go through our criteria.
Mm-hmm. And how many apps has ORCHA?
And I would recommend.
Oops, go ahead.
No, I was going to say, and I would recommend it as well, because things are kind of moving towards that, and where our criteria are quite very stringent compared to other regulated bodies out there. And we, as I say, we're advising governments on how to do this, because it's a new thing for a lot. I mean, it's a new thing that wasn't utilized before, so everyone's learning, and we're ahead of the game in that regard.
Totally. In the US, is there a digital health regulatory company?
I'm not aware of any.
Oh my God. And do you only review things in Europe, or do you do US apps too?
So I don't know if we've rolled out in the US. I'll have to double check, but we are based in some countries in Europe and the Middle East and the UK. In terms of the roles that I do, because I can relate it to our regulatory processes here, the companies that I'll mostly review are UK based ones, but we'll also, so I think, so in the past year, we've been really trying to push to help healthcare organisations in the UK adopt some of these digital technologies. So we've been focusing on the UK ones, but we say, you know, it is a global company, and so it's global.
Wow. Okay. Still, the questions are coming. All right. Next question. How many apps has ORCHA reviewed?
I don't know the number to that. It's so bad. Maybe I should have looked that up.
No, it's okay. You do a specialty, right? You look at the women's health apps and stuff.
Exactly, but it's in the thousands. It's literally in the thousands. And the review team, there's a big review team that will just filter through everything and all domains. And there's particular team, they're a big part of the company, and they will go through all of them and kind of have them through the system and then churn out kind of the not great apps, and then eventually, you know, the good ones will come to us for review. Because there's a multi-layered approach to how these apps are looked at. So we do the baseline review first, and then we do the clinical assessment afterwards.
Yeah. Well, that's just like anything, right? Like grant reviews or venture capital investing, right? You have some people doing the first filter, second filter until it gets to the like general partners or the ObGyns, right? So that's, I can totally see that process. What are some of like the biggest problems, or like what's like the easiest way to be disqualified from even getting to the next round? You know, like what are some of the biggest problems that ORCHA sees in digital health apps?
So again, I can't answer that one as much, because that would go through, I'd have to ask one of the developers, actually, not the developers, one of the reviewers about that one, because they'll be able to know exactly which ones kind of get like you said, disqualified or don't go through the next process. But I think it really varies, and because we have like, I think there's 5 or 6 domains, and each of those, the questions end up being, there's about 200 odd of them, so it's quite a big process that's undertaken. So a lot of apps will just not fulfill certain things. A lot of them will be like, there'll be some data protection issues that seems to come up a lot, but whether that's a true that's kind of anecdotal. So I wouldn't be able to tell you exactly what the biggest issues are at the moment.
I know that there was some concern about women's health apps and data protection, especially as a very popular femtech business model right now is actually getting the employers to pay for these apps, services, whatever, so that their female employees can benefit from it. But there has been concerns about like, well, do the employers ever get access to that data and find out like if a woman's trying to get pregnant or whatever? Is something that you see, and like what can digital health apps, like what should they be building in the first place for data protection?
Yeah, so that would be a concern. So really you want to make sure that data is secure, and that if it is shared with third parties, that's declared in a clear way. Because that's a concern, especially like I imagine in the UK, in the US, where you've got insurance-based things, or you don't want to be sharing certain things with your employer. That's that wouldn't be
not good.
Yeah.
How does the app downloader, like a consumer, know if an app has been reviewed and approved by y'all?
So we have the library, so you can look up things on the library and see what score it's being given. And then also a lot of the apps will actually put it on their website to say it's been reviewed and recommended by ORCHA. That's what a lot will do. It kind of gives them that badge as well and encouragement.
Good. Yeah. Like something I'm thinking about is, you know, as somebody who in the past, I had a company with an app, and so I hired developers, and like I understand the submitting to Apple, like I know the whole process, like it's a major pain in the butt actually. And so my question is like, how do app developers who are developers and not doctors like you, like make sure that they're on track to get approved from the beginning, right? Because the last thing you want to do at your startup is spend any money building something that isn't going to be approved, right? And I know you and I were talking about this before the recording started, that, you know, these are all people who aspire to do good in the world, even if they don't get approved, right? Like, it's not like they're these evil people out there. They're all like good-hearted, like they're trying to build something right. So how do we make them all succeed in terms of like hitting all the right marks? How do we do that?
So in terms of with us, I always say, so I'll have developers reach out to me kind of on LinkedIn and things, and just ask me for some advice. And I'm always happy to give advice where I can. And also, I always say to them, you know, if you're in that process, kind of come to us as early as possible, and we can really kind of help you with that process and help you with what are the steps that you need to do to make sure that your app is approved. And actually, what we, beyond kind of the help that we give them in terms of how to make this a good app that we would then be happy to recommend, we a lot of there's a kind of a high payoff for the developer, because we end up, it's on our library, we end up doing a lot of the groundwork for them. We end up, when we have discussions with healthcare providers, we say, have you heard of this app? It's on this, it will solve this particular problem in your pathway. And we sort of actively recommend them, because we really want to just provide good healthcare apps for people and make them accessible. And we want for example, in the UK, the NHS to know about them. We want to help the NHS with some of the problems that it may be having, and help it provide the best care to patients as possible. We're not just obsessed with apps for the sake of apps. We want to really just see how these technologies already exist and how can we actually use them to improve healthcare and to improve patient care and improve things like compliance with medication or recovery following surgery. And so it's a really good relationship that we build with the developers.
I mean, you are obviously an MD who's pro technology, right? But do you find that in general, most medical doctors are like, once you tell them like, hey, you should like literally prescribe this app to your patient, like, do you get a lot of pushback, or are they all on board? Like, is it a generational thing? New doctors are all for it, old doctors not so much. Like, tell me about that.
Yeah, so I'm an anomaly because I'm already in technology. So me recommending something, it's like you said, I'm already, for me, technology, I've grown up with it. Whereas for others, at the end of the day, we want to make sure that, so there's two arms to this. So as a doctor on the ground, it's incredibly frustrating when kind of the leadership in a hospital just rolls out a piece of tech or a piece of software, and there's little training, and you suddenly have to use it, and actually it becomes really, really difficult to do your job. It takes twice as long. So you want to make sure that when you do develop something, you're taking your workforce into account and not adding that burden onto them, because doctors and nurses and other healthcare professionals working in large health systems like the NHS, we're already overburdened, we're overworked. We don't want to have like some more thing thrown on us, some more system thrown on us that's just going to make our lives a lot harder. So you want to make sure that that's done in a way that you've got your workforce behind you and supporting that and championing that. So actually, so when I do look at apps, I do have that in mind as well. So I'm like, is this actually going to make people's working lives a lot harder, or is this something that's really simple that can easily be implemented into existing systems? So that's a consideration I take into account. You'd be surprised how the technology in hospitals is still so lagging far behind. We still use Windows systems that are 10 years old. Up until recently, where we're using faxes. So you really want to you want to make change and make things easier, but you'd want to do it in a way that you don't alienate your workforce.
Absolutely.
And that's one of the things about the pandemic, actually. It kind of forced everyone to accept technology, because we had to think of new ways of working, and it really fostered that appetite for innovation to make our lives easier.
Totally. Like, people are so set in their ways until you absolutely have to adapt, right? Like, that's literally how evolution works. Like, biological evolution, a lot of people think that it's like slow and steady mutations over time, No. We're actually super stationary in our evolution until something really big happens, huge pollution, climate change, like, a volcano, I don't know, like whatever happens in like this organism's life. And then there's like this dramatic change, right, to evolve. And so like, that's how I feel like our healthcare system just was like old and steady and was like, well, whatever, Windows and faxing works good enough. And then the pandemic happened and it was like, oh God, okay, we're growing. But now here we are, right? We're in like this new lineage of how healthcare can be delivered and done. That
Absolutely.
really reminds me, listeners, if you are an aspiring founder, early stage founder, and you do not have an MD as an advisor, please get an MD as an advisor. At Femtech Focus, we see a lot of products that have been, you spent a lot of money on already making, you've spent a lot of sleepless nights creating, And yet when me and my co-founder, Dr. Julie Hakeem, look at it, we're like, have you ever talked to a doctor? Because I don't think this is ever going to be accepted by a hospital, or it's never going to fit in a vagina. Like, so make sure everybody, even if you're a digital health app, get an MD as an advisor. Like Dr. Fatima here is saying, you know, there are things that need to be considered that app developers usually don't think about, right?
Absolutely, 100%. And what's really exciting is that we've also had a midwife very recently join our team, and that's just made the kind of process that we're doing so much more comprehensive in the women's health section, because she sees patients in a community setting, and I don't get access to the community. I work in secondary care and not primary care. So that's been really awesome, because now we can both kind of put our brains together and look, particularly the pregnancy, childbirth and early parenthood apps, and bring both of our expertise from the different angles that we have. So it's pretty awesome, and she's very cool. I think she's doing a PhD in public health, I want to say, but it's just made that whole process even more comprehensive.
Have you seen a lot of Femtech apps coming in the pipeline?
So what I do, so I don't just get like a list of apps that the reviewer will be like, these are the ones that I found that have passed the baseline review for you to have a look at. What I'll also do is I'll end up I take quite an active approach, and I think that's because I am really so interested in women's health, that I will look out for Femtech companies and scout them, and then if I find something, so in the past year I had to develop a digital care pathway to really kind of from the pandemic to demonstrate to hospitals where health apps can meet some of their unmet needs, and not only meet some of their unmet needs, but also enhance the service. And so I was finding really good solutions from a clinical perspective that would really solve some of our biggest needs, but they weren't passing the baseline review, and so therefore we couldn't recommend them. So I'd bring them to the review team, be like, this is a really cool app, we need to like start a conversation with them, maybe offer them to do we do the review for free, but to give the analysis, that's what costs. But most of them will be, really happy to engage with us, particularly over the last year. And as I say, it's really, really affordable. So I'll end up scouting some of these companies and being like, this is a great solution, we need it. And so put it on ORCHA's radar. And then they'll get in touch with them. The review team will get in touch with the developers and start that relationship, and help them kind of bring it up to scratch so that I can say, yes, we can use this.
So there are some Femtech companies in the pipeline, but it's actually increased because you're actively finding them and being like, women's health needs all the help it needs, and you're like recruiting them in, and you're like, let's make all the women's health apps amazing. That's what I mean. Yeah. Especially
when it comes to things like, particularly in this last year when we needed to have a bit more telemedicine and remote monitoring. So there was a few apps that were monitoring people's blood pressures that I was like, we need to have this, like we actually need this, at home blood pressure monitoring, because it would save people having to come into hospital especially if you've got preeclampsia, you need to come in so often, and with COVID you don't want to be coming into hospital. Also, it's a nuisance, without COVID, a lot of these women, they have children, they have childcare issues, they are working, they need to take time off work all the time, they need to sort out childcare all the time. It's expensive, like traveling to and from the hospital, especially if they're needing to use public transport, for example. So post-pandemic, these solutions are still very, very important. It's not just but like I said before, like COVID just made it that adoption a lot quicker. So yeah.
We talk a lot about accessibility to health and wellness here at Femtech Focus, because what we've learned through our own research is that, sure, there's some areas of saturation and innovation for women's health and wellness, but usually it's only saturated for affluent white women. And all the other women, it is not solved for.
Yeah.
And accessibility is a huge one. Women living in counties that do not even have an ObGyn. Women, 98% of perinatal specialists, which is what you see when you have high risk pregnancy. I know you know that, but for our listeners, I name drop these things. Perinatal specialists, 98% of them work in major cities in the US. If you do not live in a major city and you have a high risk pregnancy, how are you going to get, you shouldn't be traveling 5 hours, every month to see this specialist. So we need accessibility, women with other kids, women without access to a car, women with, working at an hourly wage job that, they can't just take off whenever, like telehealth, right? And digital health products are going to be a way that they can get access to the care that they need. But if we look at discrepancies in like the quality of healthcare, we need to make sure that these apps, although they can access them, let's make sure that they're actually on par with going into a doctor, right? Like, I'm preaching to the choir here, I know, but I'm just putting it all together in my mind.
You say it so much better than me, because you can tell I don't do these often, but it's and actually accessibility is one of the things that we look at when we're doing the reviews.
Really? Tell me more about that.
So we'll look at just like what you said, really. Is a success, will this particular health product actually already marginalized populations, or does it solve some other populations as well, their needs, and improve that accessibility? So things like, is it translated into different languages? Because not everybody speaks English, something as simple as that. And then invariably, a lot of digital health products, some people who are on the poverty line, they don't own smartphones, they don't have Wi-Fi in their home. That's a real issue. We have to kind of like highlight that, so that's so that healthcare providers can not just go all in on digital. Like, this will potentially marginalize already marginalized people. So one of the things we do look at is accessibility and equality and diversity.
Mm-hmm. And so ORCHA is like this independent company, right? And like you're consulting with the government, potentially app stores, but like, do you think that this will ever become like an app store requirement? Like, when you submit your app to be in the app store, like it has to go through people like you before it gets approved, or even like on a governmental level, like GDPR, data protection stuff? Like, do you see this as like, we're ever going to make it universal, like requirement?
It's a really good question. So I know there are other companies like us, so ones that just basically independently review and assess these apps. Whether the app stores will start to do that, I don't know. That's a good question. I'm sure they have their reasons why they shouldn't.
Yeah, and so then all the apps, right? They're like, why would they care?
Exactly. So then it falls on. It makes sense. So then it falls on, the other thing is then governments passing laws to say you can't make these claims, just like you have the FDA approving things. So I don't know. I'd like for us to be in a situation where it comes to health apps making really big claims, that there are rules in place to prevent them from doing that. Because like in the past, there were apps literally where you would use your camera on your phone, and the technology hadn't existed, it didn't exist, and you just scan your wrist and it would tell you what your blood pressure was, and it was being downloaded by millions of hypertensives, just because they wanted that reassurance that their blood pressure was normal. And the same with diabetes as well. People were using apps where you could just scan your hand or something, it would tell you your blood sugar readings, and people were downloading those as well. And there's some real like fully dangerous apps that I think,
oh my god,
it would be good to just like, that is not safe.
Oh my gosh, yeah, this is crazy. What you said that you do work with government, so does that mean that the governments are interested in it?
So ORCHA as an organization will consult with governments and also help them with their so I know ORCHA was worked a lot with NHS Digital and NHSX to help them with their kind of app review process as well, and their regulation and things. So yeah,
crazy stuff.
I don't get involved with that high level stuff, so.
But never, this is like blowing my mind, because I consult and meet digital health app developers and founders all the time, and it's like, I even need to question myself. Have I ever said, like, thought to myself, hey, has this app actually been reviewed, by a doctor? So this is such an important need. Let me ask you, what do you hope the future for digital health apps looks like?
What do I hope the future of digital health apps? So, okay, let me think about that one for a moment. I want them to be accessible to everyone. So, regardless of where you're from, what language you speak, this app solves your needs and is accessible to you. It doesn't marginalize you. I want them to really put the patient, if it's a healthcare app, or the client or the user, really at the center of everything they're doing, so that they're truly solving their needs and making their experience with whatever healthcare condition they have a little bit better. And I want them to also put healthcare providers in mind as well when they develop them, and not make already a stretched workforce and a burnt out workforce make their lives even harder. I want them to make our lives easier, because technology is an adjunct. It should make our lives better. It shouldn't make it worse. And so that has to be in mind. And then lastly, I won't go into this, but all the ethical implications when it comes to data being mined, I want that to be done in a very responsible way, that you don't actually end up harming the individual user and actually using the user as a commodity or as your coin.
Absolutely. Yeah. Are there certain women's health and wellness like genres that you wish there was more digital health apps addressing?
So women's health genres. So I know, so a few years ago, or a couple of years ago, menopause wasn't being addressed, but now there are lots of, thankfully, digital health solutions in development at the moment trying to address the menopause, and some have already been developed. And I think that's brilliant. I think that's fantastic, because menopause was just completely overlooked. Menopausal women were completely overlooked. Nobody really talked about it. Nobody really complained about it. Women were suffering so many years with symptoms of the menopause, and they had no idea there were symptoms of menopause, because nobody talks about the symptoms of menopause, except for everyone knows, oh, you get hot flushes, but it's so much more than just hot flushes. It affects everything, from your brain to your skin to your hair, to your mood. So menopause was one that I felt really could be disrupted, and I still think it can be disrupted, that space. There's still a lot that can be done, but I know that there's lots of really cool companies coming out that are trying to solve that.
Awesome. I have one last question for you. What do you think the femtech industry as a whole needs the most right now in order to be successful?
Oh, okay. So so I think, and I did jot down some ideas here, so I'll just go back to that.
Let's hear it.
Yeah. So the biggest thing that femtech industry needs right now is funding, and for people to ask the right questions and speak about femtech and bringing more awareness to the needs of women. We need more women investors and women in leadership positions to really drive those changes forwards, because we can always start things at like a grassroots level and in grassroots movements, but if we don't have people in leadership positions or take a top-down approach, then we're not going to see the change at pace that we want to see. That's my view.
I love it. Women at the table and more funding. That's what we need.
Yeah, because it's only like what 4% or something of funding goes into that. So the statistics are really shocking.
Yeah, the amount of VC capital, venture capital that went into femtech companies in 2019, it was less than 1% of all investing. Less than 1% went into women's health. Isn't that insane?
Wow. That's insane. Sorry, so it's 4% in healthcare research funding, 4%.
Yeah, 4% for pharmaceuticals R&D budgets, 4% is for women's health R&D. Isn't that crazy? Like, that's the podcast, y'all. Like, because I just think it's so crazy. It's emerging. Vaginas are emerging. Why? How is this now only a thing? But whatever. We're on the road. We're doing it. There's people like you. There's people like me. There's people like Wern. Like we're doing it. We're birthing it. We're growing it. We're bringing awareness. The thing that I'm most excited about is, as an entrepreneur, serial entrepreneur, I've had many ideas or things I thought were cool. And, there's lots of people that are naysayers. That comes with the territory. Femtech has been the only thing that, like, I'm going on 18 months of talking about it without anyone pushing back. Literally everyone is like, really? That sounds important. How can I help you? And I'm like, all right, y'all, but seriously, you feel free to tell me it's a bad idea or like it's not important or it's already fixed. No, everyone's like on board. So that's been really cool experience.
I mean, yeah, it's really shocking when you look at the statistics because women, because of the health science gap, I guess you can call it that. I think that's what it's called. But women are literally dying because their healthcare needs are not met. And this is not even going into specific needs of women's or specific conditions of women, such as PCOS and endometriosis, which are a huge thing in their own right as well. This is things like heart attacks. Women are, I think it's 17% more likely to die of a heart attack. They're 50% more likely to what was the thing? Maybe cut that one out. I've forgotten now. But they are 17% more likely to die of a heart attack, and that's because of the biases inherent within the way that we practice medicine. And it wasn't until I think 5 years ago that the NIH mandated that research funding have to include female animal models before they could fund that research. So what about all the research that was happening before then, and all the medications that we're prescribing to women that are based on male cells and male animal studies? It's, when you look at it, it's insane. And it's not just from treatment. So we're prescribing the wrong drugs at the wrong dosages that might not even work for female bodies because we didn't want to test on mice that have periods because it's, the menstrual cycle was too many variations. So scientists wanted a standard male model that yielded consistent results. But hang on a minute, women don't have a consistent, that's not how women's biology works. So your research is on male animal studies, and then that's being extrapolated to then fit into women. So invariably you're giving them the wrong treatment, and as a result women are dying and suffering as a result of that. And it's not just the drugs, but it's also things like diagnosis and diagnostics. So coming back to the heart attacks, up until recently we were using the biological markers that we were using were based on men. The particular enzyme, it was based on men, and it's released when you have a heart attack. And I think it's from the cardiac muscle. I'm forgetting my cardiology now, but women's hearts are smallest. So we were actually missing diagnoses from women because we were measuring the wrong levels. And then on top of that, again, it's symptoms. So, I mean, the situation is really huge, and women's healthcare concerns is a huge problem, and it's a $500 billion problem, which is the same actually as diabetes. So you can tell I'm really passionate about it. And I
know, girl. The other week I was listening to a conference with some scientists out of Switzerland and Sweden. They had a few European scientists. Very, very heavy research. Like, I wouldn't put this on Femtech Focus website. Like, it was very graphs and science, but I loved it. But they had a laboratory. They were studying nanotechnology, so little nanoparticles delivering drugs to certain areas of the body. And the PI, so the guy in charge of the lab, said, yeah, my grad student messed up and used a female mouse instead of a male mouse. And when you put female mice next to male mice, they automatically get their period. So that's just mouse biology, blah, blah, blah. So the student messes up, uses a female mouse, takes the image, brings the image to the professor, and he's like, you silly PhD student, like, you used a female mouse, you never use female mice. And the PhD student said, yeah, but look what happened. So what happened was, turns out when the mouse is on its period, the nanoparticles collect in the uterus and don't actually go to the target site of where the cancer was for the drug development. And like,
that's so significant. Oh my God.
2021, we just figured out, damn, maybe women on their periods are not having drugs delivered to the right place.
Oh
maybe
my
we
God.
consider that as a variable when we give drugs to humans. Like, are you menstruating or not? Because based on that, like, our biology is going to prioritize blood flow and shit different. Like, blow my mind, right?
Yeah.
Like, this is insane. This is like, why I don't know why I'm not overly funded, you know?
Yes, I know exactly.
You're listening and you have opportunities for grant funding or like whatever, like, please fund us, because like this is the type of stuff we're trying to bring awareness to. Crazy.
Absolutely. And I remember the statistic, they were 50% more likely to be misdiagnosed with a heart attack, and they were twice as likely to die from a heart attack 30 days within a heart attack than men, even though it's shocking stuff. And now you're telling me about this cancer. I mean, the implications are so phenomenally huge.
We don't even know how many women are dying based on gender bias. We don't even know, right?
Yeah. And it goes the other way as well. So not just are we giving medication that can potentially harm women or not work or at the wrong dosages, but also we're potentially denying them of potential treatments that could have worked on them that didn't work on the male mice models, but may very well have worked on women. So we're potentially denying women of treatment that could have worked. And I know, think about that one.
In our capitalistic society, which I don't necessarily like to use money as the reason to care, you should just care about women. But if you care based on money, wouldn't you think that the pharmaceutical companies of the world, they're missing out on drugs that they could patent and get money from because they're not testing on the female mouse or the models, right?
So, yeah, exactly.
Oh my gosh.
So it makes sense from everything, from an ethical perspective, from a humanitarian perspective, from a financial perspective, from a capitalistic perspective. It just makes sense.
Somehow religion is in there as well. I know it. Like there's all of the angles. It all just agrees. Femtech is important. Well,
do you know what I read, like, but just prepping for this interview, that Aristotle had described the female form as the mutilated version of the male form. So, and that kind of like thought process about women and women's anatomy has permeated really to this day. If you really think about it, and historically the way that we've done things and conducted research. If you really go into like the history, it's insane.
Think about even like Eve was made from Adam's rib, supposedly, right? So it's like the woman is derived from the man as well. So we're two different genders and sexes, and oh my God, we have so much to talk about. Thank you so much for your time today. You are amazing. What you're working on is so important. I knew that I had to get you on the show when I met you in Clubhouse. So you're incredible. Thank you for all you do.
Thank you so much. Thank you. And it's been an absolute pleasure. And I'm so happy that you and I met. And I'm just really grateful for the work that you're doing to really just get this message out there. And hopefully, things are changing and they will continue to change with people like you at the helm and others. So thank you very much for having me as well.